Hello, I'm Nancy Bush, one of the incident commanders at the Emergency Operations Center at Clackamas County, and also the county's Disaster Management Director. Today is Friday, April 24th, and we want to provide you with a few updates. Since the county declared an emergency on February 27th, we have been monitoring the COVID-19 pandemic from the Emergency Operations Center, or the EOC. We are continuing to provide accurate and helpful information to the public. We are providing resources to cities, fire districts, and our local partners, and we're sharing details on how we can all do our part to keep each other safe. Today, we want to provide you with a glimpse into the work of the EOC. I am pleased to introduce Evan Polk, one of our leaders for the operations section.
Thank you, Nancy. Again, my name is Evan Polk, and on regular work days, I'm the sustainability manager for the county. Today, though, I am excited to share what we do in the operations section of the EOC while we respond to the COVID-19 pandemic. Operations is one of 5 sections that make up the EOC, and we partner with the liaison, planning, logistics, and finance sections, all under the direction of the command team. The operations section is the hands and feet of service delivery during the pandemic. On any given day, we are working with human services, business services, behavioral health, and public health teams to support our community. As you can imagine, these teams are very busy responding to community needs related to the novel coronavirus. In particular, the public health team, whose mission is to control and further prevent the spread. They are diligently working with those who have COVID-19 contacts, hospitals and clinics, and they're coordinating with the state on the tools that we need, such as testing and contact tracing, to support reopening for business. The novel coronavirus is new for everyone, and every day brings new challenges. When the pandemic began, our main objective was to understand the status in Oregon by rapidly identifying cases and isolating the contacts to control the spread. But as case numbers increased in Oregon, we shifted to broad mitigation techniques to support the capacity of our hospitals and clinics to protect the most vulnerable. We continue to investigate cases and trace contacts on every positive COVID case in Clackamas County. We also have a team working with businesses who have questions about closures, federal stimulus dollars, and questions about reopening. In coming days, we will also release an online tool to help businesses communicate to our community when they are open. Meanwhile, our human services team and behavioral health team is working to make sure our most vulnerable residents have what they need to stay safe and survive. As the pandemic continues, we are starting to look ahead, and while we don't know when things will reopen, we are planning for it. The best part about this job is that you, the community, can help. By staying home and staying safe, you help prevent new outbreaks. Less exposure means our public health team can close investigations quicker, maximize the resources available to our hospitals and first responders, and most importantly, help us realize a reopened community much, much sooner. I'm Eben from the operations section of the EOC. Thank you for listening, and remember to stay home and stay safe.